Radiation Safety for Nuclear Medicine Workers, presented by Astarita Associates, consultants in medical physics and radiation safety. Any institution that uses radiation for diagnostic or therapeutic purposes must name a Radiation Safety Officer, or RSO. The RSO is an individual responsible for the day-to-day safe use of radiation at the institution and must be present 50% of the time radiative materials are being used. They are qualified through training and experience in radiological health to evaluate and mitigate radiation hazards. All unsafe conditions must be reported to the RSO. Radiation is often depicted as a mysterious, deadly force. In truth, there's nothing mysterious at all. Radiation has been studied for over 100 years. Detection, measurement, and radiation control are extremely common events. The more the public understands, the less frightening it becomes. Radiation can be a very beneficial diagnostic tool.
Radiation is often spoken of using 3 units. The Rankine, or capital letter R, is a unit of exposure in air. When that exposure enters a material or tissue, we use the term rad. The rad is the energy absorbed per gram of material. The rad takes into account the type of tissue or material being irradiated. To determine the biological effect of a rad, we use the term rem. The rem takes into account the type of radiation. Conceptually, the 3 units of radiation described are entirely different. However, for the energy ranges used in diagnostic radiology, they are approximately equal. 1 Rankine equals 1 rad equals 1 rem. The standard unit of radiation protection is the millirem. 1 millirem is 1/1000th of a rem. 1 rem is 1000 millirem.
Although in the United States, we often reference the imperial system of measurement units, staff should be familiar with the international system, or SI. Radiation absorbed dose, or RAD, in the international system is referred to as the gray, while effective dose, or REM, is a sievert. The relationship is 100 to 1. 100 rad, or 100 rem, equals 1 gray, or 1 sievert.
Background radiation is the relatively constant low-level radiation from environmental sources such as the earth, building materials, cosmic rays, as well as naturally occurring radionuclides found in the body. The level of background radiation will vary depending upon altitude, location, and the amount of natural radioactive material in the ground. The highest known background levels recorded are in the mountains of South America at approximately 1000 millirem, or 1 rem.
While the approximate natural background radiation is 310 millirem per year to a person living in the United States, it's important to understand that background radiation has a man-made component. This man-made component comes from medical procedures such as nuclear medicine, CAT scan, diagnostic radiology, as well as consumer products. There are no known proven carcinogenic effects from radiation levels in the order of magnitude compared to background radiation. Although the patient may receive several times their annual natural background radiation exposure from a diagnostic procedure, the occupational radiation worker exposure is typically within background radiation levels, or less than 310 millirem per year.
Personal monitoring is used to estimate the amount of radiation received by individuals who work around radiation. It simply measures the amount of radiation to which one was exposed. The monitor offers no protection against radiation exposure.
Personal monitoring is required for all individuals who are occupationally exposed to radiation on a regular basis. These individuals are issued a whole body badge. Monitoring is also required for individuals who handle military quantities of radioactive material on a regular basis. These individuals are issued a ring or extremity badge. Individuals who are occupationally exposed to radiation on an occasional basis, such as nurses caring for radiopharmaceutical therapy or therapeutic implant patients, will be issued a whole body monitor when caring for those patients. Other individuals who are exposed to radiation on an occasional basis who are not likely to receive 10% of the maximum dose limits are not issued exposure monitors. This would include secretarial staff, security personnel, and nursing staff who infrequently work with patients administered with diagnostic radioactive materials. Personal radiation monitors in nuclear medicine are exchanged on a monthly basis. The monitors are typically worn on the chest or collar and are positioned outside of a protective apron if an apron is worn. Pregnant workers are to wear the issued fetal monitor at the waist level under the protective apron if an apron is worn. Records of exposure are promptly reviewed by the radiation safety officer and are maintained indefinitely. The dose limit to an occupational radiation worker is 5,000 millirem or 5 rem to the whole body, 15,000 millirem or 15 rem to the lens of the eye, 50,000 millirem or 50 rem to an extremity. If a fetal monitor is worn, the limit is 500 millirem for the entire gestational period. We monitor to ensure the dose to the fetus is less than 50 millirem per month. Facilities establish action levels that allow for corrective action to be taken to ensure dose limits are not exceeded. These are called ALARA levels. An ALARA level 1 means an employee is likely to receive greater than 10% of the annual dose limit based upon the quarterly readings. In this instance, we notify the employee and remind them of basic radiation safety protocols. An ALARA level 2 indicates the employee is likely to receive greater than 30% of the dose limits and requires further action, such as investigation of work practices and causes for the increased exposure. ALARA level notifications are a useful tool to ensure radiation exposure to personnel is as low as reasonably achievable. ALARA, ALARA. Shown here is the typical ALARA notification letter. It is important to note that ALARA levels may vary from jurisdiction to jurisdiction and are allowed to be adjusted by each facility, and even for different groups of workers at the same site. The ALARA levels shown here in this letter are the New York State recommended levels.
Exposure from nuclear medicine patients. Patients injected with radiopharmaceuticals emit relatively small amounts of radiation. The activity for diagnostic procedures is extremely low and poses no real danger. The typical exposure from a technetium-99m sestamibi scan is less than 0.2 mR per hour at 1 meter from the patient. A thallium-201 perfusion scan is less than 0.05 mR per hour at 1 meter from the patient, and a typical bone scan using technetium-99m MDP is less than 0.1 mR per hour at 1 meter from the patient.
When an occupational radiation worker is pregnant, they have the right to declare or not to declare their pregnancy. If they declare their pregnancy, a fetal monitor is issued and worn at the waist level. The dose limit for the radiation exposure over the gestation period is 500 millirem. The goal is to maintain an exposure of less than 50 millirem per month. It's important that the declaration is in writing using the appropriate form, such as a declared pregnancy of radiation worker form. Shown here is the typical notification form that an employee may use to declare their pregnancy in writing to the radiation safety officer. The use of radioactive materials is limited to qualified individuals with the radiation safety training approved by the radiation safety officer. In addition to the licensed nuclear medicine technologist, other medical professionals such as physicians and nurses may be appropriately trained to administer radioactive materials. There are limitations to the scope of practice for a nuclear medicine technologist. The technologist may start an IV line only for the purpose of a radiopharmaceutical administration. Other than a saline flush, they may not administer any other pharmaceuticals, even if it's part of the nuclear medicine procedure. This would include Lasix and dobutamine. Practitioners who direct the technologist to administer pharmaceuticals other than radiopharmaceuticals are aiding and abetting an unlawful practice. An authorized user is a physician named on a radioactive materials license who uses and/or supervises the use of the radioactive material. They do not need to be on premises during the administration of diagnostic radiopharmaceuticals by a licensed nuclear medicine technologist. However, they must be on premises and in the room during the administration of a therapeutic radiopharmaceutical by the licensed nuclear medicine tech. As noted previously, Any institution that uses radiation for diagnostic or therapeutic purposes must name a radiation safety officer. The radiation safety officer is responsible for the day-to-day operations and safe use of radioactive materials and radiation. They must be present 50% of the time radioactive materials are being used. All unsafe conditions should be reported to the RSO immediately. Radioactive materials may only be used in designated areas. These may include the hot lab, where radioactive materials are stored and measured, the imaging room, the stress room, and the preparation and injection rooms. Areas where radioactive materials are used and stored must be posted with appropriate caution signs. These areas may include the hot lab, imaging room, stress room, and preparation rooms where materials may be administered. Although patient waiting rooms do not need to be restricted, some facilities will provide for a separate radioactive materials waiting area. There is no eating, drinking, storing of food, or personal items allowed in the restricted area. In addition to universal precautions such as gloves, remote handling techniques, and the use of protective clothing, there are three cardinal rules for radiation protection. These are time, distance, and shielding. Minimizing your time around a radiation source will reduce your overall exposure. It is important to take your time to safely complete the task at hand. So when possible, tasks such as patient education and preparation should be performed prior to the radioactive material injection. A good example is the placement of EKG electrodes prior to the initial injection when performing nuclear cardiac stress testing procedures. Distance offers great protection from radiation. Radiation exposure follows the inverse square law. As you double your distance from a radiation source, your exposure is reduced by a factor of 4. Doubling your distance results in 1/4 of radiation exposure. Whenever you can, think about taking one step backwards. Shielding of radioactive materials should be utilized where appropriate. This includes shielding of the unit dose during transportation and administration, as well as the radioactive waste. The half-value layer, or HVL, is the amount of material needed to reduce the exposure of radiation by 1/2. For technetium-99m, this number is 0.3 millimeters of lead. There are some general nuclear medicine guidelines that should be followed when administering radioactive materials. Only physicians listed on the license may approve the use of radiation in humans. Radioactive materials should only be used in designated areas. These would include the imaging room, hot lab, and treadmill room, and these areas should be posted with a radioactive materials warning sign. There is no eating, drinking, or smoking in radioactive material areas. Lab coats, syringe shields, and gloves must be utilized when handling radioactive material. You should educate and prepare the patient prior to the injection of radioactive material to reduce the occupational exposure. Radiation safety instructions to patients are only required when the administered activity of radioactive material exceeds the level determined by the Nuclear Regulatory Commission. For technetium-99m, this level of activity is 150 millicuries and is based upon the amount of radiation exposure a member of the public may receive from an injected patient. Therefore, instructions to patients are not routinely given in diagnostic nuclear medicine because the administered activity is typically 10 to 30 millicuries, well below the 150 millicurie threshold. As previously noted, the requirements for patient radiation safety instructions are needed when the administered activity of technetium-99m exceeds 150 millicuries. This is well above the activities administered for diagnostic examinations. Other than special precautions for patients currently breastfeeding or undergoing therapeutic procedures, radiation safety instructions are not required for most nuclear medicine exams. It is important to reassure the patient and alleviate their radiation concerns. Because radiation detection is routinely utilized by law enforcement in the public sector, local agencies have suggested for facilities to provide an identification card or letter to patients receiving radioactive material injections. This is helpful to immediately mitigate a situation should a patient trigger a radiation detector. Breastfeeding cessation guidelines are provided to patients receiving radioactive material injections who are currently breastfeeding. These guidelines are provided by the Nuclear Regulatory Commission document titled New Reg 1556, Volume 9, and are located in Appendix U. The regulations are in place to ensure the dose to a newborn infant is less than 1 millisievert, well below the requirement of 5 millisieverts. As you can see, breastfeeding cessation guidelines differ for isotopes as well as the compound tag or ligand. For example, a 30 millicurie injection of technetium-99m per technetate would necessitate interruption of breastfeeding for 24 hours after administration, whereas the same activity of technetium tagged with sestamib requires no interruption at all. To be safe, many facilities will often have a policy for a 24-hour breastfeeding cessation for all technetium-99m agents. Should a radioactive material examination need to be performed on a pregnant patient, it must be performed only after consultation with the ordering physician and authorized user. The risks must be explained to the patient, and a fetal radiation exposure will then be calculated.
General Environmental Services Guidelines. Cleaning should only be performed in authorized areas. Do not enter the hot lab or other restricted areas unless authorized to do so or under direct supervision of authorized personnel. Do not empty containers bearing the radioactive label. When cleaning, conventional cleaning solvents can be used. Some facilities have mounted waste monitors. These monitors are designed to detect small quantities of radioactive material in the waste and linen. It is important to walk slowly through these detectors. At least 6 seconds is ideal. When the alarm is sounded, store the waste in the designated area.
There are times when non-authorized staff, such as maintenance personnel and engineering, may need to enter the radioactive material storage areas. It is important to note that non-authorized personnel should only enter these areas under the supervision of nuclear medicine staff. Receipt of radioactive materials, a special note for security. During normal business hours, radioactive packages are routinely delivered to the designated area within the nuclear medicine suite, such as the hot lab or receiving closet. For off-hour delivery, the radioactive material transporter should check in with security personnel and be escorted to the designated receiving area in nuclear medicine. For off-hour deliveries in medical offices, the transporter is typically provided a key or entry code for direct access to the receiving area. Receipt of radioactive packages by nuclear medicine staff. Radioactive package deliveries must be monitored within 3 hours of receipt. In situations where the deliveries are made off hours, packages must be monitored within 3 hours of staff arrival. It is important that the staff wear gloves, visually inspect the package for problems, measure the package for exposure at 1 meter and then at the surface, and a white test must be performed whether or not contamination is suspected. Packages containing radioactive material must be properly labeled for transportation. The type of label is used to identify the contents, activity, and exposure emanating from the package. It is important for the technologist to understand the definition of each label when receiving and shipping radioactive materials. If a package containing radioactive material has a surface exposure of less than 0.5 mR per hour and a wipe test of less than 6,600 dpm per 300 square centimeters, that package can be labeled Accepted Package Limited Quantity with a UN 2910 label, if and only if the contents of that package meet the DOT limits, meaning 11 millicuries of technetium is the maximum amount of technetium allowed in that package. Also, 11 millicuries of thallium. F18, only 1.6 millicuries. Gallium, 8.1 millicuries. Iodine-123, 8.1 millicuries. If a package contains more than one isotope, the maximum amount in that package will default to the low limit, and that maximum amount is the total, meaning if there's more than one isotope, such as F18 and technetium, the total contents cannot exceed the F18 limit of 1.6 millicuries. When a package containing radioactive material has a surface exposure of less than 0.5 mR per hour, has a 1 meter exposure that is not detectable or indistinguishable from background radiation, a wipe test of less than 6,600 dpm per 300 square centimeters, and exceeds the activities in the accepted package limited quantity requirement, it is appropriate to label this package with a Type 1 white label. A yellow Type 2 package label is used for packages containing radioactive material that has a surface exposure of greater than 0.5 mR per hour but less than 50 mR per hour, has a 1 meter exposure of less than 1 mR per hour, and a wipe test of less than 6,600 dpm per 300 square centimeters. The TI index, often referred to on this label, is the 1 meter exposure. When the radioactive material package is less than 200 mR per hour on the surface, less than 10 mR per hour at 1 meter, and a surface wipe test of less than 6,600 dpm per 300 square centimeters, the appropriate label is a Type 3 yellow. Any radioactive package that appears damaged should be carefully assessed for contaminants. Should survey or wipe test results of any radioactive package exceed limits, the package should be set aside and the RSO contacted. In many cases, the supplier should be contacted to remove the package. Surveys for ambient radiation are performed using a Geiger-Müller meter, often called the Geiger counter or GM. Contamination surveys or wipe tests are analyzed using a single or multi-channel analyzer, typically called the well counter. Ambient radiation area surveys are performed at the end of the workday using a GM meter. The survey should be performed less than 1 centimeter from the surface and as slowly as possible. Remember the buzzwords, low and slow. Use the most sensitive scale, often the 0.1 scale, and keep the audio switch on. Wipe tests are performed for removable contamination. They are performed weekly using the well counter. It is important to wipe test a 10 by 10 centimeter area, or 100 cm squared. When performing surveys and wipe tests in the nuclear medicine suite, facilities may adopt the action levels established by the Nuclear Regulatory Commission, their local regulating agency, or develop their own stricter limits. In New York State, the action level for ambient radiation surveys is 1 mR per hour in the restricted areas, and the wipe test limit is 5,000 dpm per 100 centimeters squared. However, many facilities adopt the clean area limits of 0.5 mR per hour and 1,000 dpm. When these levels are exceeded, decontamination procedures must be initiated. There are some special notes on the GM meter. The GM meter is calibrated for cesium-137 with an energy of 662 keV. The GM meter is sensitive, but not accurate at lower energies. It is excellent for fine contamination, but not for a true radiation exposure. For true radiation exposure, the use of an ion chamber is appropriate. It is accurate and is usually performed by the medical health physicist. During the course of operations, radioactive spills may occur. It is important to understand that this event is common and there are procedures for proper handling. The NRC and Department of Health define spills as either major or minor, and this is based upon an activity threshold. The difference between a major and minor spill is how the spill is handled. The NRC sets the threshold for a major spill versus minor spill at 100 millicuries for technetium-99m products. New York State recommends using 10 millicuries as a general guide and allows up to 30 millicuries if only technetium products are utilized. When a minor spill occurs, it is important to notify all people in the area that a spill has occurred. Prevent the spread of the spill by covering with absorbent paper, such as a chuck. Clean the spill using gloves and remote handling techniques, such as tongs. You want to clean the spill from outside in to prevent spread, and place all waste in a plastic bag. Survey the area, including all personnel involved, and then complete a spill decontamination report. Give this report to the nuclear medicine supervisor and the RSO to review and sign. Should a major spill occur in the nuclear medicine lab, the procedure is somewhat different from a minor spill. It is important to first clear the area, notify all personnel to vacate the room. Prevent the spread of the spill by covering with absorbent paper, such as a chuck. If possible, place shielding on top of the spill, but only if it can be done without further contamination or increasing exposure to the staff. Close and lock the room to prevent entry. Put a sign on the door notifying staff that it's a radiation area and a spill has occurred. At this point, notify the RSO. Survey all personnel for contamination. If contamination exists, use mild soap with lukewarm water, and a surgical sponge is also helpful for removing contamination from under the fingernails and cuticles. Clean the spill only under the supervision of the RSO. Complete a spill decontamination report and report the findings to the nuclear medicine supervisor and the RSO for review and signature. Radioactive waste is commonly generated in the nuclear medicine lab. One way to handle the waste is to decay the waste in a storage area. Waste with a half-life of less than 120 days may be stored in the nuclear medicine areas for decay. It is important to store this waste in a shielded container. Label the waste with the date and the longest lived isotope. Although no longer a nuclear regulatory requirement, New York State still requires that radioactive waste be held for a minimum of 10 half-lives. For technetium, that would be 60 hours. Thallium, 30 days, F18, 18 hours. Prior to disposal, survey the waste to ensure it is indistinguishable from background. Remove all radioactive labels prior to final disposal and maintain a record of disposal for a minimum of 3 years. In addition to decay and storage, radioactive waste may be transferred to an authorized recipient. This vendor is authorized by the Department of Health to handle radioactive material either by decay and storage or transferring to an off-site burial facility. Sometimes your facility may be limited in storage. Transferring to an authorized recipient might solve this problem. Also, unused doses may be returned to your radiopharmaceutical vendor in addition to the used doses. When sending these doses back, it is important to follow DOT guidelines. When returning unused or spent doses to the radiopharmacy, your facility becomes a radioactive materials shipper, and it is important to follow DOT guidelines. In this instance, you want to use the limited quantity accepted package label. In order to use that label, ensure the package survey is less than 0.5 mR per hour on the surface, the white test is less than 6,600 dpm per 300 square centimeters, and the package is limited to a total of 11 millicuries of technetium-99m or 11 millicuries of thallium-201. If both isotopes are in the package, the total package cannot exceed 11 millicuries. Misadministrations, now called medical events, may occur in the nuclear medicine lab. A medical event is defined as a radiopharmaceutical or radiation from a source other than ordered by the physician, such as the wrong drug. A good example is injecting a patient with technetium-99m MDP instead of the ordered technetium-99m sestamivir. It may also be a radiopharmaceutical or radiation to the wrong person. It could be a radiopharmaceutical or radiation by the wrong route of administration other than the one ordered by the doctor, such as IV versus oral. It could be administration of a diagnostic radiopharmaceutical that's more than 50% of the intended ordered activity, or the administration of a therapeutic radiopharmaceutical of more than 10% of the intended activity. Although reported internally, medical events are only reportable to the Nuclear Regulatory Commission or local Department of Health if the dose to the patient from that medical event exceeds 5 rem to the whole body, 50 rem to any individual organ, or is an activity of greater than 30 microcuries of iodine-125 or iodine-131. The typical radiation dose from 30 millicuries of technetium-99m is not reportable to the Department of Health because the whole body radiation dose is less than 2 rem and the dose to a large intestine is only 6 rem. The Nuclear Regulatory Commission, as well as the Department of Health, publishes a safe use of radioactive material guideline, which all staff should be familiar. You should wear a lab coat or protective clothing when in radioactive material areas. Wear gloves when handling radioactive material. Monitor your hands for contamination after each procedure and before leaving the radioactive material area. Always use syringe shields when preparing and administering doses, except when patient care may be compromised. Do not eat, drink, smoke, or apply cosmetics in radioactive material areas. Do not store food or personal items in these areas. Assay all patient doses prior to administration. Ensure each dose is within 10% of the prescribed dose. Check the ID of the patient by two methods, such as name and date of birth. Always wear monitoring devices when working with radioactive materials, whole body badges, ring badges if applicable, and store the monitors in a non-radiation area when not in use. Dispose of waste in only designated areas and in properly shielded containers. Never pipette by mouth. Separate radioactive pipettes from non-radioactive pipettes. Survey generators, kit prep areas, and injection areas daily for contamination. Confine radioactive solutions in clearly labeled shielded containers. Label it with the compound name, isotope, date, time, and assay. Maintain flood sources, syringes, waste, and other material in properly shielded containers. Use plastic-backed absorbent pads when using radioactive aerosols to prevent contamination of surfaces. Use a cart or wheeled device to move radioactive sources. Always transport the source in a shielded container. This presentation was put together using several references which staff should be familiar with. These include Part 16 of the New York State Sanitary Code, Article 175 of the New York City Health Code, Title 10 of the Code of Federal Regulations, Parts 20 and 35, New Reg 1556, which is the NRC guidance for radioactive material licensing, as well as Radiation Guide 10.1, New York State's guidance for radioactive material licenses. Other references of interest should include pharmacopoeia guidelines, such as USP 825, and of course the Joint Commission.